February is National Children's Dental Health Month, an initiative to help promote good oral hygiene in kids, highlighting that early habits are key for lifelong dental health. Dr. Jessie McAllister from McAllister Dentistry is with us this morning to share some great advice for kids and, of course, parents as well. Good morning to you.
Good morning.
Okay, let's talk about the significance of having a month like this for kids.
Yeah, so it's so important just to raise awareness about the importance of your oral health on your overall health, especially when it comes to kids.
Yeah.
Because starting good habits early in life is going to set them up for success long term.
And when should we really start brushing our kids' teeth?
Yeah, so that's a great question. It's a question that I get from parents all the time. And the rule of thumb, the golden rule, is by their first birthday or about 6 months after that first tooth erupts.
Okay.
So first birthday, first dental visit. That's
So
how you should think about it.
Okay, so by their first birthday, they should go to the
Yes.
dentist and start brushing their teeth.
Yes.
Let's talk about brushing our kids' teeth, because it can sometimes not be overly easy. It can be a bit of a challenge. What advice do you have for parents to make sure we're able to brush their teeth?
Right, so this is another really common question, and as a mom of two myself, I know how difficult it can be. It's even hard for myself to get my kids to brush their teeth. So we have a few tips that can make it a little bit easier and a little bit more fun. So one of the things is starting out with some good books. So reading to your kid before bed, talking about the dentist, and making it fun and engaging. So that's always really good, especially to set them up for that first dental visit so they know what to expect.
Okay.
And then in terms of brushing their teeth, a couple of good things. One thing that I absolutely love is just like a fun toothbrush, allowing them to pick what character, what colors on their toothbrush. It's all about giving kids choices, right? They love choices. So you want to say, which toothbrush, I'm going to use a pink one or the blue one, and giving them that option. Electric toothbrush is also an amazing option. So if you're able to invest in a good electric toothbrush, that can make all the difference. This particular one from Philips Sonicare has a little app that goes along with it, and my kids love it. It has stickers that you can decorate the toothbrush with, and the app allows you to actually track how they're brushing, how long they're brushing, and it makes it really fun and interactive for them.
And it gives them like little prizes if they
little
brush
rewards.
a certain time. I love that. Okay, as parents, if we are brushing our kids' teeth, what should we be trying to do in the mouth?
So one of the things I always tell parents is lift the lip, because a lot of times the cavities are forming right here at the gum line, and if you're not lifting the lip, you could be missing those areas. The other thing is you need to help them brush. So we say that kids can only independently brush their teeth when they can tie their own shoes.
Oh, wow.
So if they can't tie their own shoes, you need to be helping them brush. You can let them start, and then you want to finish up and make sure they didn't miss any areas. You want to get right here at the gum line and make sure that you also get back to those molars, those hard to reach areas. That's where those cavities are going to form, and also in between the teeth. So we always tell parents, wherever the teeth are touching, if your kids don't have spaces between the teeth, you need to floss. If you're not flossing, you're missing those areas in between the teeth.
Okay, let's talk about some more advanced dental practices, biofunctional therapy. Tell me more about this. This is something parents should be looking out for.
Right, so at that first dental visit, we're not just looking for cavities. We're looking for potential airway issues. We're looking for tongue ties, lip ties. How big are their tonsils? Are they breathing well at night? Do they grind their teeth? These are some of the warning signs that there could be a bigger issue that we're missing. And again, that's so important for the overall health and development of our children. So as an airway-focused dental office, we really focus on doing a screening for all patients, including children. So one of the things we want to look for is to make sure that if they are mouth breathing, we stop that habit early on. So we say we want the tongue up, the lips closed, and breathing through the nose. So if you notice your kids watching TV and they're sitting there with their mouth open, there could be a red flag. There could be an issue that you want to bring up with your dentist, somebody that focuses in airway. We also have some little tips here in terms of keeping that nasal passage clear, so we know kids can be congested and a lot of colds and flus going around. We want to make sure we clear out the nose so that they're able to breathe through the nose and they don't start mouth breathing just as a habit. And then we have some fun little tools here. Again, could be for young kids, even babies, to start chewing properly. We have the Myo Munchie, we have the Froggy Mouth, and then we also have this Invisalign palatal expander. So we can actually start expanding kids as early as 6 years old. So we want to expand that palate because the roof of the mouth is the floor of the nose.
Wow.
So if we can make the palate wider, we're going to increase the space in the nose for kids to breathe properly. And it's going to make a huge impact on their development and their overall health.
Amazing. Well, thank you
Yes.
so much for joining us today. Again, you can head to the website mcallisterydentistry.ca for more information with so many great tips. Thanks again.
Thank you.